Please join us in welcoming Bloomberg Fellow Jordan Smith with the Hawaii Department of Health.
Jordan promotes healthy eating and active living for young children through population-based prevention strategies.
I'm Jordan Smith, the Child and Youth Specialist from the Hawaii State Department of Health's Chronic Disease Prevention and Health Promotion Division. My work focuses on increasing opportunities for healthy eating and physical activity for young children aged birth through 5. Research tells us that the first 24 months of life are the most crucial to healthy development and lifelong wellness for our young children. To make sustainable change, we must start with our youngest citizens. We must improve the systems in which they live, counteract adverse childhood experiences, and help make the healthy choice the easy choice. There's no one solution for this complex public health issue. The pandemic has elevated the importance of and need for strong public health and chronic disease prevention programs, since many of the chronic diseases we try to prevent heighten the impacts of COVID on those who become ill. It has also allowed us to work with new and existing partners in innovative ways to meet the complex needs of our island chain. Next, we'll hear about the important role data plays in connecting hunger to obesity in the food system.
Welcome, everyone. I'd like to welcome Jess Fanzo and Valarie Jernigan. They're going to be speaking to us today about what we call the double burden of obesity and hunger, and how that those two conditions exist in a lot of communities around the country and around the world now. And Jess, I'm going to have you briefly just introduce yourself and say who you are and what you do, and then we'll turn it over to Valarie.
Great. My name is Jess Fanzo, and I am a Bloomberg Distinguished Professor at Johns Hopkins working on food systems issues.
Thanks. And Valarie, if you'd like to introduce yourself.
Sure. Hello, everyone. My name is Valarie Jernigan, and I'm a professor of rural health and medicine at Oklahoma State University Center for Health Sciences, where I also direct the Center for Indigenous Health Research and Policy.
Great. Thanks, Valarie. So Valarie, we're going to start with you. So when we think about how these two conditions happened in the United States and the trajectory that they took, back in 1969, the White House held a conference, and it was about hunger in the United States. And there was also a documentary that was aired called Hunger in America. And that is frequently pointed to as when Americans sort of woke up and understood that hunger, even though it was somewhat invisible, was very present in the United States. And we've seen over the last few decades that there's been a pretty big shift. So when we associate hunger with people who don't have enough to eat, we often think that they are, wasting or they're thin because they don't have enough food. And in fact, in the United States and around the world, we're seeing that that isn't the case anymore, that obesity is also exists along with hunger. So we often call this the double burden. Valarie, can you talk a little bit about how this has played out in the Choctaw Nation?
Sure, I can. I speak from the perspective actually of a researcher, but also as a citizen of Choctaw Nation of Oklahoma and a tribal member. And I can share that the history of the food system inequities has actually been a much longer history for Native communities because of the forced removal and relocation to reservations. So that history actually started a lot longer ago. And the big transition that occurred was the separation, and even in many areas, the destruction of Native people from their traditional food systems. In our populations, the food systems have special meaning. Food is sacred to us. It's considered a sacred gift. And so when you remove Native people from our spiritual, cultural, traditional obligations to care for the land and to care for the food, you see what has happened. You have the extensive disparities that we experience today, higher rates of diabetes, obesity, hypertension, all of the diet-related disparities that are very, very high in Native communities. And my Native nation in particular, it's a reflection. It's a reflection of what has occurred with that forced removal and relocation. People are often really surprised that hunger and obesity might go together, but it's actually not a very big surprise if you spend much time in rural or Native communities. You can see that there's a plethora of fast food restaurants and chain restaurants, and those restaurants are actually much more plentiful than fresh vegetables and fruit and grocery stores. And so what happens is that people tend to overconsume those high fat, high sugar, high sodium foods that are cheap and readily available. And they tend to eat many more calories than they actually need. And so that's when you see going hungry, but also over consuming when you can have access and do have money and can buy you're going to buy fast food. It's cheap, it's available. And that's where you get that hunger obesity paradox that we talk a lot about in public health.
Thanks, Valarie. I would love to hear more about some of the work that you've been part of and work that you've witnessed that others have been doing addressing some of these issues. Is it like programs? Is it policy? Is it everything? Like, where do you see sort of bright spots and possibilities for change and structural change, especially?
When I started my career in public health and academic medicine, my work focused at that time, about 20 years ago, on diabetes self-management. We almost didn't really do a lot of work in preventing diabetes because we didn't really have much to go on as far as the diabetes prevention program hadn't really been readily disseminated across tribes. And so I actually got into the area of food system work through an initiative that was being implemented in California to improve commodity foods. As a Choctaw person, I actually grew up eating commodity foods, and they're USDA surplus foods that are provided to tribal communities on reservations. They used to be typically canned and packaged food. Nothing was really fresh. A lot of changes have been made over the last 20 years, but that's kind of the diet that I grew up eating, and really didn't have fresh vegetables until I was in my 20s, actually. And at that time, 20 years ago, we were working really hard on getting refrigerated food trucks to deliver the commodity foods. That's how my career really started. And I almost worked backwards from there, where I eventually got into food system work and farms on tribal lands, and really getting focused on source and, how can we create sustainable long-term solutions to food insecurity and some of these diet-related disparities that we see. The kinds of things that we've been doing have been intervening at multiple levels in the food system. So we intervene at the retail level, where we make sure tribal stores have access to and can sell healthy, fresh vegetables and fruits. We actually intervene at the schools. So we've done some farm to school interventions. And most recently, we're intervening at a community level with a partner tribe, Osage Nation, to launch a community-supported agricultural intervention. And that is really how we've seen a lot of progress at addressing long-term solutions.
Thanks, Valarie. Jess, we'd love to hear from you about how this transition, the double burden transition, has happened on a global scale, and where do you see some of the interventions that countries are taking to prevent or slow it down entirely?
I think I have about 30 seconds. So what we're seeing at the global level is very much what Valarie said, in that many countries are going through a nutrition transition. So low and middle income countries that are still grappling with hunger and undernutrition are now grappling with overweight, obesity, and non-communicable diseases. And it's very much the diet that Valarie described as being spread across the world, this ultra-processed foods and sedentary lifestyles. The US diet, while it can be aspirational, is also quite detrimental to health of many populations around the world. So that's what we're seeing, is this double, triple burden of malnutrition, diet-related non-communicable diseases in places in rural Africa, South Asia, everywhere. What's being done is a lot. The UN Food Systems Summit just happened. There's a big push to try to improve not only the supply of healthy commodities, like what Valarie was talking about in the communities where she works. So trying to ensure that agriculture reorients towards better nutritious foods, but also trying to improve that last mile, ensuring that markets have healthy foods. A lot of the work, Anne, that you do in Center for Livable Future is looking at food environments, markets, ensuring that there is healthy, affordable, safe foods for the global population. And that's really been the big push. And we're seeing a lot of really interesting country examples, particularly in places in Latin America, Chile, Mexico, where there's a concerted effort to either educate the public through front of the pack labeling, regulate industry to ensure that their foods are healthier through reformulation or taxes, fiscal policies. So there's a lot of work happening in food systems to try to ensure that communities can get access to healthy diets. The big issue, though, as Valarie said, as we move into the middle, we're still very deeply in the middle of a pandemic, are the inequities. Many disadvantaged, marginalized communities that have suboptimal food systems, which translate into poor diets and the burden of malnutrition. So that's the next frontier, is trying to close the gap of those inequities. And that very much deals with larger issues outside the food system, social justice, fixing structures, systemic issues related to, particularly in the United States, racism, marginalization, and vulnerability. But I think, in the global level, and I think in the US, people are deeply worried about climate and how much progress we can make on hunger, and at the same time, obesity, when we've got climate change barreling down on us. So we're in this period of this syndemic, multiple pandemics happening. So the challenges are pretty immense, but there's some pretty incredible country work going on to try to improve diets around the world.
Thanks, Jess, and thanks, Valarie. It was great to hear from both of you.
Thank you.
Thank you.